All right, so this morning we're talking about this game-changing technology. It's a treatment to plump up your skin instantly. Joining us this morning, board-certified dermatologist Dr. Billy Groff of Cosmetic Laser Dermatology. He's here to show us a little bit about how this works. So this is brand new stuff that you have here this morning, right?
Brand new. It just became available about a week ago. So the exciting thing is that this is the first volumizer or filler that's FDA approved to treat the cheek area. The other great thing about it is it lasts up to 2 years. All the other fillers on the market right now last maybe 6 months up to a year. So we're getting at least twice the length of product lasting where we inject it, which is pretty amazing.
It's pretty cool. And we've got Phyllis here, and you actually did just one side of her face so we could get a good look.
That's correct.
At how this works. Tell us what you did.
Yes. Yesterday what I did was I injected, you can see I'll come around here. I injected into her temple area, into her cheek, the fold, and down here to soften everything on that side. You can see actually when you inject into the temple area how it lifts that brow. If you look at the left brow compared to the right, you see a nice lift. You can see the softening under the eyes. You don't have the kind of the dark circle or the hollowing under the eye. And everything looks really natural. It doesn't look overdone. It's not too much. So this is truly almost what I would call a liquid facelift, and it will last up to 2 years, which is amazing.
2 years?
Yes, that's correct.
Wow.
Yeah, if you look on the other side where I didn't inject, you can see, you notice right here, there's a lot of hollowing in her temple here, which ages the look of anyone really that has that. And you can see underneath the eye how there's hollowing here, there's a lot of depression here, and there's depression through here. So those are all areas that I injected on the other side with this new product, VOLUMA. And these results should last her up to 2 years, which is great. So she comes in the office and then she gets results that'll last 2 years. You can see I just injected her yesterday and there's minimal swelling. So you can really, she could go out tonight, no problem. Or she could have went out yesterday. She could have went to an event, a party, out to dinner, no problems.
Phyllis, can you tell us what it felt like? Was it painful, and why did you want to get this done?
It feels like a momentary pinch, and it gives a subtle improvement. And that's, I think, what we're all looking for, natural look.
Mm-hmm. How do we make sure that we get a natural look and we don't get that overdone look that a lot of people have?
Exactly.
Too much.
Well, I think this product helps a lot because it's made from hyaluronic acid, which is a natural component of our bodies. That's one thing. Of course, the other thing is not to overdo it. You know, a lot of injectors and even patients get overzealous and they want more and more and more, which isn't always better. Sometimes less is more, and we just want a nice, subtle correction and get a nice lift, which looks very natural.
We actually have some before and after pictures of folks who've had this done. Tell us a little bit about what we're looking at right here.
So on the left you see the before, and on the right you see the after, and you can see how with that volumization of the cheek, it kind of lifts things up and it just looks natural and it makes her look more youthful, and that's what we're all looking for.
And then do we have another one? Nope, that was it. Let's talk about price. What are we looking at?
Okay, well of course that's going to vary patient to patient depending on how much we need to do, but I'd say price starts at about $800 and can go up into the thousands depending on how many syringes a patient might need.
How many syringes did we, obviously we just did half of Phyllis's face here, but how many did we use about here?
So we did 2 on her so far, so we're going to have to do 2 more most likely on the other side to correct. So, you know, she would be into the over 2,000 range anyway.
Who's the best candidate for this?
Well, I think we see a lot of women mostly in their 40s, 50s, and 60s that are looking for an alternative to surgery, and you can see this is a great alternative because you do get that lift. It looks very natural, and there's 0 downtime. Pretty amazing.
Dr. Groff, thank you for being here. We really appreciate it. Once again, it's called, say it again, VOLUMA?
VOLUMA.
VOLUMA, okay, very good.
Yep.
If you'd like to get in touch with Dr. Groff, you can do so. The information's up on your screen right there, located in the UTC area. Phone number is up there as well. They're located at Genesee Avenue. We've also got a link on our website, fox5sandiego.com. You can go there and click on that Scene On tab.